Welcome to Minor Matter Strength and Condition. My name is Oscar and I'll be your host. For previous videos and more progressions, please visit the channel. Hi, my name is Oscar. Welcome to Minor Matter Strength and Condition. Thank you guys for joining. This is our series on bunion treatment and how to prevent and avoid bunion surgery. This video will teach you what is a bunion. The other videos will help you avoid bunion surgery by helping you stretch, doing a couple simple stretches and exercises to help avoid a bunion surgery. Now we're going to go over what is the bunion, what actually causes it, and how it can be prevented. Now a bunion is a deformity of your big toe called your hallux valgus, but it can also affect other parts of your foot, like the outside of your foot, and a bunion usually happens back over here. And the first signs and symptoms of a bunion is redness that occurs back over here. But it's usually due to the big toe and the joint of the first two toes. Mostly the joint of the first toe. And these bones are called your metatarsal joint and our metatarsophalangeal joints. And what happens is as you put your feet in an uncomfortable position, such as a high heel, what happens is your feet have no other choice but to come together. Now, that's when usually, like the first signs and symptoms of a bunion is redness on the outside of your foot. Now, it can progressively get worse. As this foot turns in more, this one will come out more. But you can correct that and help avoid it by simple stretches and exercises. Now, many things cause bunions. Shoes are the most common ones, especially for women who wear high heels and they put their feet together throughout the day for long periods of time. That usually happens where your toes come together. Now, you can do the opposite motion because it's a repetitive stress that you're doing. So the opposite motion is actually extending your feet apart. Specifically this big toe. This big toe is usually the main culprit of why a bunion happens and how can it progressively get worse. But you can ameliorate the pain of a bunion by simple stretches and exercises that I will show you in different videos. Now, a lot of people who are at risk are usually women, but also guys who wear improper foot, such as really tight feet. So you want to be able to kind of keep your feet open. So you want to have proper footwear. Now, a couple solutions to a bunion is actually surgery, but that's actually probably one of the last things you should do because you should avoid surgery at any cost. Not only is it painful, but it also costs a lot of money. Now, a simple device that you can use is actually a toe separator that you can get. And this toe separator is usually used in nail salons, especially for if you get a pedicure. And what happens is this simple device can help you by simply spreading your toes apart. Now, as you keep on doing this, what happens is if you ever wear braces, it kind of works similar to that, where you're actually spreading the toes apart. You're forcing them apart, away from each other. Now, if you ever wear braces, the reason why your teeth get crooked because they get punched in. So I like to use that analogy because it's something that we can all, not we can all relate to, but it's simple to describe. And you can see how this toe goes out. Now, you can leave it here for a minute and then relax. What you're doing, you're actually stretching these toes back over here. So now it's going to become proper alignment. And you can see how your feet, the toes are being separated equally. And after about a minute, you can remove it and rest for a couple seconds and then do it 3 or 4 times. Now, there's a simple treatment that you can help decrease the chances of you having surgery, bunion surgery. And it's a really simple treatment that you can do almost anywhere. So after you remove them, you can see how the toes come back together, and you can see how this toe it's also kind of developing a bunion, and mostly due to the improper footwear. Usually, like I said, high heels or any other kinds of shoes that that bring your toes together and don't allow movement. So by actually performing this exercise, you can help see how every single week, if you take a picture, you can see the progression of it actually getting better. So I would recommend taking a weekly picture and seeing how effective it is. Now there's exercises and stretches that you can view in different videos, and this one will be one of the stretches that you would do, but it's a simple way of actually alleviating bunion pain and helping avoid bunion surgery by correcting your bunion. So you want to keep it not at the bottom, but right near the top. So if this is a perfect opportunity for you to actually get a pedicure and just kind of leave it there, and you can see once again how they are separated, which makes sure that this one is not bunched up. So this toe is known as your hallux. This big toe is known as your hallux valgus, and this metatarsophalangeal joint is usually the problem because it goes out too much. Now by doing this, in essence, you're actually correcting that bunion. So once again, you can take weekly pictures of these guys, and you can see how this will not only ameliorate the pain of a bunion, but it will also help correct the problem. And for any questions, comments, or concerns, you can just post a comment at the wall or check out the other videos for a continuation of stretches and simple exercises that you can do at home and try to avoid a bunion surgery.